Okay, this is thumb adduction, and it's the adductor pollicis that we are testing.
All right, so the patient is going to be sitting with their forearm in pronation, and their thumb is going to be relaxed and in abduction. The therapist is going to stabilize the metacarpals of the four fingers, and the patient is going to be asked to bring their finger towards their thumb towards their index finger. And if they can do that, then that is a 3. To test for a 5 or a 4, the therapist is going to apply resistance on the medial side of the proximal phalanx and ask the patient to bring their finger towards their index finger. If they can do that against maximal resistance, it's a 5. A little less resistance would be a 4. If they can't do a 3, to test for a 2, you would have to put them in an anti-gravity position, and their forearm would be halfway between supination and pronation, and the therapist would want to stabilize the wrist. To test for 2, the therapist asks the patient to bring their thumb down towards their index finger, their ring finger. If they can do that, then that's a 2. If they can't complete the range of motion in an anti-gravity position, then to test for a 1, you would look for contraction of the adductor pollicis, which is the web space between the thumb and the index finger. And it's really hard to palpate, but if there's any contraction at all, then that would be a 1. And if you can't feel any contraction, then that's a 0. The substitutions would be the flexor pollicis longus and brevis, which would flex the thumb and attempt to make it look like it's adducting, and the extensor pollicis longus may also attempt to adduct the thumb by extending the carpo-metacarpal joint.